Hello friends and welcome to today's video. I'm Dr. Mohsen Raj. I'm a DM cardiology student at AIIMS New Delhi. I've done my MD from AIIMS New Delhi. Now this video is about this interesting news that is there on the internet that likely NEET PG 2023 would be the last NEET PG and then NMC will switch to next exam. So we knew about this next. We already knew about it since 2020. So we'll talk in a little bit more detail about it. So the news says that NEET PG 2023 is likely to be the last NEET PG, and this is to be replaced with next, that's National Exit Test for MBBS students. So we already knew that this is what NMC is planning, that immediately after your final year MBBS, you will appear in this next part 1, okay? That will do a couple of things. One, that will be an exit exam for your final year MBBS. That will be the final prof exam. Okay. Second, that the marks you score in that exam would actually be taken into consideration for allotting you a seat in postgraduate courses, right? For the MD/MS seats. And third, this will be a common exam, whether you're a graduate from India or you're a graduate from any other country, a foreign medical graduate. This will replace even the screening, the MCS screening or the FMG exam that used to be there. So in a way, it's a common exam that Indian graduates or foreign graduates will appear. They have to qualify to be able to, practice medicine in India. Okay, so this will enable you to become a registered medical practitioner. Okay, and plus the number of marks you score will be taken into consideration for the consideration of MD and MS courses. Now, question is, who will face it first? So as the news says, well, this is not actually a statement from NMC official. We don't have the news from MCI or NMC, so we'll have to wait for the official news. But this is what the news says, that likely 2023 would be the last NEET PG, which means that people who have just finished their final prof, who are going to join their internship, they will appear in this last NEET PG. And the students who are in their final year MBBS right now, they might have to appear in the first next exam. So it's always a little scary to be the first batch to appear in a new pattern of exam, and entirely it is the biggest change in MBBS I feel, from decades. This is what has happened, the first biggest change. From decades, people have been, doing MBBS, finishing their internship, then preparing for NEET PG, appearing in NEET PG, and then just a name change. It became ICT for AIIMS and PGI put together. But the point is, this is the biggest change, that it mimics the pattern of US or USMLE stuff, right? Where you immediately after undergraduation, you appear in this USMLE, and similar thing has happened. Similar thing has been enforced into medical, MBBS course in India as well. So who will face it first? MBBS students who are right now, who have joined final prof, you have to be ready. You have to start preparing like next exam wants you to prepare, right? People who are in third year, definitely you have to start preparing. Now, pattern, we already know about the pattern. There's a previous video on the channel as well. The information is quite easily available that clinical subjects will predominate the question paper. Almost 90% of the paper will be based on clinical subjects. By that, I mean the subjects that you previously used to study in final prop, medicine, or some allied branch of medicine, including psychiatry or dermatology, surgery, the allied branch of surgery like ENT or ophthalmology, okay, or some short subjects like orthopedics, okay, or ophthalmology, then obstetrics, gynecology, or pediatrics. So those are the core clinical subjects that will form the majority of the paper. PSM might contribute 10% of that as well. The preclinical ones, by that I mean the subjects that you read in first and second prop, the anat, the biochemistry, physiology, or microbiology, or pharmacology, or forensic medicine and stuff like that, that will constitute little like 10% of the actual question paper. So which is plus point in some ways. I'll talk about that. Now, when to start preparing? Now this is the time you need to start preparing. If you are a third year MBBS student, you need to gear up. If you are a final year MBBS student, definitely you need to gear up. Now, what about first and second years? Well, that's a different story. They have time to see what's going to happen to people who are in third year or final year MBBS, right? Now, what are the resources that I suggest? This is what I recommend previously as well. Standard books, at least for these 4 subjects. At least for medicine, you read the standard textbook of Harrison. For surgery, you read the standard textbook of Bailey and Love. For obstetrics, you read the standard book, whichever is being followed at your institute, maybe the book by Sharma or book by Datta, whatever it is, or whatever. Pediatrics, you read the OP guy. Okay, so those are the core subjects. You need to read standard books, and you need to make your own revisable notes after reading these standard books. See, the content doesn't change. Exam pattern may change, NEET PG may become next, but medicine doesn't change, surgery doesn't change, pediatrics doesn't change, obstetrics, gynecology doesn't change. You read the subjects. You also look at previous year question papers of AIIMS, NEET PG. Yes, that's important because you need to know, because the examiners will also not change. The paper setters will be the same. So you need to know their mentality. You need to know the hot areas. So the same questions that have appeared in NEET PG, the same questions that have appeared in AIIMS will serve as a guide as to which areas are more important, right? Plus there will be a clinical tinge to the questions, right? So it's important to attend clinical postings in your third year and your final year MBBS. Okay, so once you know the hot areas, what do I mean by hot areas? The common cases that you see in your ward. What else? The questions that have been asked in AIIMS previously, the questions that have come in NEET PG previously. Mark those areas in your standard textbooks, read the subject well, read those topics well, prepare your own handmade notes that you can finally revise in a matter of maybe 10-15 days. So make your own revisable notes for these big subjects. For smaller subjects, maybe for ophthalmology or for ENT, you may not read the full textbook of ENT. Maybe your coaching notes may suffice. Maybe your coaching notes may suffice for anesthesia, maybe for dermatology, maybe for psychiatry. But for these 4 subjects, please read the standard textbook. Okay? Then, what do I feel are the pros of this? What are the benefits of having this next? And by the way, I've also given you a video on the changed MBBS pattern recently, the NMC bill that had a recent change in this year. So they're sort of preparing to shift to next. Now final prop is 1.5 year. So 1.5 year, you'll read all the clinical subjects, and immediately after reading for 1.5 year, you'll have to appear a next exam, which is based on those clinical subjects. So it's pretty easy. Now you don't need to read anatomy in detail. You don't need to read biochemistry in detail or microbiology in detail. No, they're just 10% of the paper. Okay. You need to focus on subjects of final prof, or subjects that you used to read in third prof and fourth prof, the clinical subjects. So go to clinical postings regularly, learn from the rounds, learn from the patients, know what are common clinical scenarios, read those things in detail from the standard textbooks, revise the questions of previous year question papers of AIIMS and NEET PG. They'll still be the same areas will be important. Why? Because the examiners are the same. The subject is the same, just the type of questions they're going to ask will be slightly different. Okay, so that's one advantage. Second advantage, yes, for foreign medical graduates, you don't need to appear in multiple exams, screening, and then a NEET PG if you want to do a PG. This is a common exam. And third, it mimics USMLE in US also. Like it's almost like step 2 CK. Right? Your step 1 is basically the preclinical subjects. So that has just 10% weightage in next. This next exam mimics almost, it's a mimic of step 2 CK. And one more advantage that I feel is that once you're done with this exam after your final prop, so this means you have 1 year of internship that you can fully invest in developing clinical skills. This is probably one of the reasons why they made this important change from NEET PG to next, because they want students to learn during their internship. We don't want doctors who don't have basic skills of all the subjects. See, during internship, you will know basics of anesthesia, you will know basics of obstetrics, how to conduct a normal delivery, how to assist a cesarean section. You will know the basics of surgery. You will get to deal emergencies in general medicine. So you will have a lot of exposure, right? So that 1 full year of internship will add to your clinical value. Because otherwise what used to happen, people used to bunk internship, learn nothing from the internship, just read MCQ books and coaching during internship, and they join whatever branch. They join radiology or they join medicine, and they know nothing about emergencies and obstetrics. They know nothing about obstructed labor. They know nothing about anesthesia. They know nothing about pediatrics because they haven't attended these internships during their internship. Okay. What are the cons? The cons, I feel, is just one. It is that who will be the first guy, who will be the first batch to face this exam? So this uncertainty, it creates certain amount of anxiety, but I believe you need to be reassured and need to believe in yourself and know this fact that subject is the same, the examiners are the same. It is just they will tweak the questions a little bit. You're in a way, you have been relieved from the stress of revising anatomy. That's a big pain to revise anatomy in internship or biochemistry or microbiology. You don't have to revise those subjects that well. Maybe you're coaching, maybe short notes, maybe some subject wise tests you may appear. That's another good strategy. You might read and revise subject wise tests for the preclinical subjects, because 10% of the question paper, that much of effort is enough. Previous year questions of NEET PG and AIIMS, and test and discussion subject wise tests for those preclinical subjects. You don't need to revise pharmacology in detail. You don't need to read an MCQ book of microbiology in detail or anatomy in detail. No, forget it, it's gone. Now you need to focus on clinical subjects. 90% of the questions from clinical subjects. So just that, the anxiety of the first new pattern, that's the only downside I see here at this point of time. But after 1 to 2 years, even that will be gone. So it is for the benefit of medical students, I believe. So that's it for today's video. Keep watching the channel. Thank you.